am Dr. Teresa Wright. I'm a board certified family medicine physician. I'm also a certified health coach, and I help overwhelmed, overextended individuals learn to prioritize their life and health like never before. I do this through speaking, videos such as this one, and also through my coaching programs. You can find me on all social media and at www.drteresawright.com. So, having introduced myself, I would like to tell you all a little bit about what I do. As I said, I am a family medicine physician. That is what I trained for. My passion, however, is in health and wellness coaching. And my mission regarding my passion is to empower individuals, especially professionals who are overwhelmed and overextended, to feel that they could take back their health and their wellness, and to do it in a way that does not add stress to their day, does not add pressure to what they're already doing in their lives, and to do it in a way that's loving and encouraging and supportive. So I hope that gives you an idea of who I am and what my passion is and the mission that I have. Now, I have a platform for my health coaching that is Revive Wellness Institute. And what I do through that is I coach professionals. To date, I have coached multiple professionals, specifically physicians, but I work with any person who is a professional, who aspires to be a professional, or who just feels that they're struggling in their health. I work with them to, in a systematic way, to give them the tools to take back their health. And maybe they never really grasped it to begin with, and that's okay. We give you tools to understand why your health is important. Now, I should probably tell you guys a little bit about how I got here. So, as a physician, of course, we learn medicine. We learn medicine, okay? But we're not always taught how to teach that or implement that in a way that makes sense to our patients. So what I mean by that is, have you ever been to the doctor and your doctor tells you something that's maybe not so great, like, hey, your blood pressure is a little elevated or your blood sugar is a little elevated. And then they say, you need to work on that. And you say, how do I do that? And they say, okay, diet and exercise. And that's it. It's a small visit, 15 minutes maybe, and they're in and they're out, and they gave you information that wasn't very helpful, and you are left feeling kind of like it's your fault and like you don't have the tools to fix it. And so if you've ever had that experience, that's exactly what happened to me. Prior to being a doctor, when I was in college, I was actually told that I was pre-diabetic. That meant nothing to me. I was a sophomore in college. I go to the doctor. They're like, yeah, your blood sugar's a little high. You're in the pre-diabetic range. Eat well, exercise, and go see this nutritionist over here. That's exactly what I was told. And it took me about 10 years to figure out exactly what that conversation was in the doctor's office. And it was only after I myself became a doctor, I started to reflect on that conversation and look around at what was happening within medicine, and noticing that that's actually the conversation I had as a sophomore in college was actually very typical. Most of the time, our physicians, they mean well. They want to give us information and help us change our lives and provide us with the medicines. But the way medicine is set up, it's 15-minute visits, 20-minute visits if you're lucky, and it's an in and out visit. And if you don't have the tools or the resources to know what to ask, what to say, how to communicate with your physician, there's a lot that gets left on the table. And that was very disheartening for me when I realized that. First of all, when it happened to me 10 years prior, and then as a physician, reliving that experience and then feeling like I was also perpetuating that cycle was very disheartening. So I wanted to educate myself, first of all, on how do I take this conversation with my patients to the next level? How do I move the needle so that we're not just having a superficial conversation about their health, but I'm empowering them to make better decisions that would impact their lives, but also their families' lives, and ultimately the lives of everyone around them. And the way I felt like I could do that best was to become a health coach, but not just become a health coach, but I wanted to become a certified health coach, and then use those tools to empower the people around me, including my colleagues, including my patients, to do the best and make the best choices for them. So I hope that answered a little bit about that question. Um, how do I recommend that others get involved or start their own passion project? I think first you have to identify what your passion is. And one of the main ways to do that is to try a bunch of things. I know for myself, I recommend, and I have done this myself, trying multiple different things, hobbies, volunteering, shadowing opportunities, with no commitment, just with a curious mind. I think that if you encounter life with a curious mind, eventually you will find something that makes your heart beat with a song. And once that happens, then you can move to the next level. So for me, I love medicine, but I knew that there were some limitations there. And I didn't really know what that meant, what that looked like. How do I fix those limitations? So I worked with a health coach myself. I worked with a lifestyle coach. I worked with a few different coaches, learned their process, saw what they were doing, saw what made me excited about what they were doing, and went from there. Before I got to this part, when I was considering medicine, I also considered dental school and other different school tracks. And so I shadowed all those different types of professionals to see what would work for me. And so I always recommend doing that. Regarding hobbies and things like that, if you can afford to, if you have the time and the finances to immerse yourself in some hobbies, it's always good to do that, because that also helps to open up a creative part of you that maybe you don't even know you have. And that could lead to whatever your life's passion or goals are. And maybe your life's passion is something like medicine or law. But maybe there's a way to take that to another level and to curate a lifestyle that works for you by incorporating a hobby or something. And so, what I like to tell young people is that just because your grandmother or someone did it a certain way 50 years ago, doesn't mean that you have to come along with the same exact thing. You could have the same exact career and curate a lifestyle that's absolutely different and that's made just for you and for what you desire. And so I hope that is helpful. Um, so let's see. Additional information about myself. So I am originally from St. Kitts and Nevis. It's a island in the Caribbean, two islands actually. It's a federation in the Caribbean. I was there until I was 18, and then I moved to the United States of America. I actually moved to St. Thomas for a few months, and then decided that I was gonna move to the mainland, so we moved to Connecticut. I went to Central Connecticut State University, and there I specialized or majored in biomolecular sciences. Prior to that, I spent some time in junior college back in the Caribbean, and I actually did pre-law. So most people don't know this about me, but I did pre-law first, loved it. I loved pre-law, and I really thought I was going to be a lawyer. And then I moved to the United States of America, and my identity shifted. And I think that happens sometimes when you have a major life change. Your identity shifts, and law was no longer what I wanted to do. And so I had to find myself all over again. And that required me taking multiple classes. I took biology, I took humanities, I took English, I took just general education classes. And from there, I identified my new who I was now, who I wanted to be, what my new goals were going to be. And actually, I didn't decide on being a doctor until I did a summer program in school. So I say this to say, do not limit yourself. Do and feel and taste and touch everything when you're in college, because you might learn in doing that you're actually not who you thought you were. And so I was pre-law, moved to another country, realized that I was no longer that person. I had totally changed, wasn't sure who I was anymore. So I took humanities and a bunch of general education classes. And then I wound up really falling in love with biology, which was my first experience with biology. I avoided the sciences like the plague in high school. And so I did the minimum with the sciences. And so I got to college, fell in love with biology, signed up for a summer learning pipeline program through UConn, fell in love with the idea of spending my summers in a lab, dissecting animals, learning sciences. And a lot of those students were talking about being pre-med and going to medical school. And so I fell in love with that idea with them. They created this vision that I captured, and I decided that I was going to be a doctor as well. And so that's actually how I met Olotayo, Dr. Sagunro. And so what that looked like was every summer we would spend the summers in the Yukon Pipeline to Medicine program, training and doing that. So that's my recommendation. If you once you figure out what your desires are, track them down, chase them down, jump on them, hold on tight, don't let go. If it means spending your summers, your breaks, any of that, just kind of being immersed in that space around those people, doing the thing that you think you're going to love, especially if it's financially beneficial, definitely do it. Because that's how you will actually learn if this is what you want to do. I tell everyone that, you don't have to know what you want to do forever right away. But once you figure it out, you want to do it as often as you can to make sure that you're happy doing it forever. Because what you don't want to do is spend many years and hours training and doing something and the loan and the debt, and then find out that you're absolutely miserable. So speak to all the folks who are doing what you want to do. Meet with them, work with them, shadow, and then just try it out for yourself. Regarding organizations and things like that I did in before I got to medical school, I was a part of the Caribbean Club. I was a part of I think there was a science club or something that I was a part of. And you have to forgive me. I am not really great with remembering the names of things like that, but I know I was part of the Caribbean Club, the science club. Um, I shadowed and volunteered at the local hospital in New Britain, Connecticut. Of course, like I said, we did the summer program, which was affiliated with UConn. I was like an orientation leader one summer, and that was really great. I got to learn the art of orienting folks to campus and also being a leader on campus. That was really good. Um, I was affiliated with the Africana Club um, and some other clubs like that. I wasn't a member of those clubs, but I was affiliated with a lot of the folks that were on those clubs and committees, which was very good because it was a way for me to learn and see other people's lives and perspectives and culture, which I really appreciated. Study groups, of course, those are always beneficial. I always recommend those. I did a research project for the majority of my college career, just working with Dr. King in his lab. And it was just, it was a great project where we worked with DNA of mice to try to identify DNA that would tell us if the mice had infertility. It was actually male mice, and we were trying to find out some DNA markers related to their infertility. I did a research project related to that and actually did some presentations related to that as well. And I really did enjoy that. At one point, I considered, because I really enjoyed working in the lab, at one point I considered going into research. And so this is what I mean when I say try everything, do as much as you can. Because although I studied biology and some people might say that's a straight shot to medical school, I wasn't 100% sure. And so I considered research. So definitely do that as well. So here's what I would say. This is just my 2 cents on what I recommend. So I decided to become a doctor. I think it was like the end of sophomore year in college. Now, if you know anything about going into medicine, it's not something you decide to do the end of sophomore year in college when you don't have most of your prereqs. And so that's what I did. And so, of course, it was helpful that I spent a lot of summers preparing, but I definitely didn't have the prereqs I would need. And there was a chance that I wouldn't have graduated on time. So I had to cram some significant sciences in 2 years. And that was not easy. And then I decided to take a year off because I just knew that I needed more time to study for the MCATs. That's the medical school entrance exam, and I just needed more time to figure out what my plan was. And so after graduating from college, I did AmeriCorps. It's like the Peace Corps, but it's stationed in America, usually in underserved or rural communities. And when I worked with AmeriCorps, I actually was assigned to a school, Sayre High School in West Philadelphia, providing them with health coordinating services, such as I hired line dancers and belly dancers and nutritional um, planners and all the workout experts and food prep experts to come in during the weeknights and provide this community with these services. It was great. It was wonderful. At the time, I didn't realize that that was preparing me for my life, because if you know anything about West Philadelphia, um, it is an underserved community, predominantly African American. It is a food desert where the high school was located, which means that there weren't a lot of supermarkets and grocery stores. You couldn't always get fresh fruits and vegetables. And a lot of the students didn't always have meals at home. And so what we did was we provided a safe space for them to come to after school, do projects, have a meal, exercise. It was open to the community, so their moms, their grandmas, dads, anyone else could come and join. It was actually a very wonderful time. And what I didn't realize while doing that was that that was preparing me to see health as a holistic, community wide effort. And I think I could appreciate now, as a physician, that the way we impact health in one person is to impact health in their community. And again, that's one of those experiences that shaped me for who I am today. But it wasn't planned. It was just something I fell into, and so look for those opportunities: AmeriCorps, Peace Corps, different different opportunities like that in the community to give back. I know some people join sororities and work with them that way, or join other clubs and work in the community that way. I think whatever you're passionate about, if you could find a way to impact the community that you're a part of, would actually help you to learn that that's the best way to go about it. I mean, it's always great to be compensated financially for what you're doing, but more importantly, it's so good, it's so gratifying to know that you are changing the landscape around you. Uh, and then just some advice for anyone who is unsure, not really comfortable with where they are right now. Just some hope for me. Even when it looks like it may not happen, it doesn't mean it won't happen. And what I mean by that is, once I did my MCATs, that's the medical school entrance exams, I wasn't pretty impressed with my scores at all. But I applied to medical school anyways, because I decided that I wanted to live with no regret. I wanted to live life with no regret, and I wanted to follow through on what I planned on doing, which was becoming a physician. So I applied, and I just prayed for the best. And lo and behold, I got accepted. I applied to 10 schools. I got accepted to one off the bat. That's Virginia College of Osteopathic Medicine. That's the school I did go to. I got waitlisted at two or three. And one of them was actually my first choice. It was Philadelphia College of Osteopathic Medicine. That was actually my first choice at the time, because I was living in Philadelphia. So it made sense that I wanted to just stay close to home. But I got waitlisted there, and I could have waited, but I decided, well, this is my chance. I'm going to go down to Virginia, and go to this Virginia Tech affiliated school and make my life, start my life. And that was a big time in my life, because that was around the time that the Virginia Tech shootings happened. Actually happened about a week after I got accepted, and there were some folks that were encouraging me not to go because of this horrific event. And I had to make a decision. Am I going to let this event that was horrible change the trajectory of my life, or would I find a way to um, find some beauty in this place that such evil had happened? And so I decided that I was going to go and um, connect and do the best I can, and to grow something beautiful in a place that had been ravished, really emotionally, by something so horrific. And I'm thankful that I had that perspective. And so I say that to say, sometimes your dream may be unfolding, and things may happen that make you question what you should do next, what your next step should be. And your next step should be the next best thing for you, that would get you to your goal, as long as it's not detrimental to your health, your wellness, or anyone else. And so that's just some hope for some of you who are maybe in that place where you're not sure if your next step is the right step or the best step. So I kind of want to talk a little bit more about my health coaching platform. I went off a little bit, just to let you know a little bit about myself and where my journey has taken me. But I do want you to be empowered and encouraged that health coaching is beneficial. It is for everyone. Um, I'm a coach, but I always tell everyone every coach has a coach. What we learn in life is that to be your best in anything, it's always beneficial to have someone coaching you through the steps and the process. And if you think of health coaching like you would think of baseball coaching or football coaching or track and field coaching, every elite athlete, every elite sport has coaching. In life, why don't we put the same emphasis on coaching? Why are we making life and death decisions and life changing decisions without having a coach? What I call a health coach, maybe you may call a mentor or uh, a guru, whatever you want to call it, it's fine. I just like to say that definitely find someone who could support your goals, whether they're healthful or career or otherwise. And so, what I tell folks is that I partner with them and their doctor in helping to design a health plan that will benefit them to meet their goals, whatever them and their doctors set up. Now, one of the things that we do when I do health coaching is we work on mindset, because if your mind's not ready to receive information, it's really hard for a transformation to occur. So we work on mindset, we work on visualization, we work on meditation, we work on nutritional information, like legitimately. I work with you on nutritional information, how much water you should be drinking, how much activity you should be doing, what activity is best for you. Just because your friend Susan is running a mile every day doesn't mean that that's the best thing for you, especially if it's not sustainable. So I work with you on all those things. It actually is a partnership. I don't work with anyone who I don't feel that we could partner with. And so that's some more advice. If you want a transformation, you have to find a partner in your transformation, in your life, in your health, in your career. And so I hope that was helpful. As I said, I am Dr. Teresa Wright. I am a certified health coach and also a family medicine physician. I help overwhelmed individuals learn to prioritize their life and health like never before. I do that through coaching, videos such as this one, and speaking. Feel free to follow me on all social media, especially you can find me on www.drteresawright.com. I look forward to hearing from you. I look forward to working with you. I look forward to mentoring you. Whatever our journey looks like, wherever this journey will take us, I look forward to partnering with you in that. Have a blessed day.